It's 11 o'clock. This is your Thursday update for the public school systems on the Pima County COVID schools liaison group. I'm going to continue admitting some folks here just for awareness. This session is being recorded and will be posted on the YouTube channel for access to everyone on this call and just general access as a whole. There's a couple of things we're going to start out with today. I'm actually going to have Dr. Gerald take the lead. And Dr. Gerald, I've got the letter and then some PDFs up on the screen, which I'll screen share. Just let me know which ones you want shared.
Sure, thank you. I guess you can go ahead and start with one of the PDFs. It doesn't really matter which one. So thank you all for letting me speak today. Some of you may be familiar with the AZ Hero study that the University of Arizona is doing in first responders and workers that worked all through COVID. The Centers for Disease Control is sponsoring the study, and they've now asked us to open up the study to children. So we are working to enroll kids ages 4 months to 17 years old to learn about the SARS-CoV-2 infection. And even though this flyer says how well the vaccine protects children from infection, we are looking at that, but children do not have to be vaccinated to enroll. In fact, we'd love to have unvaccinated children enroll so that we can see what happens over time when some kids get vaccinated and some don't. Just to give you a little bit of idea, what's happening is parents who enroll their child will help their child participate in weekly surveillance testing. These are at-home COVID testing kits, so you don't have to go anywhere. You can do them at home, and then we'll have you drop them at a FedEx drop box. And then you'll be asking some questions about COVID. And if you and your child would like, you could go to Sonora Quest for a blood draw, or you could come to our center at the Asthma Center for a blood draw, but the blood draw is completely optional. So we just wanted to let all of you know about this study because we have had a lot of interest in people wanting to get their children weekly tested. So that is available through this study. We, as Brian mentioned, there's also a letter. This is a flyer that you can send out to anyone that you'd like. And this is a letter from me kind of describing the study. And also, we are making some more school-specific flyers that, are a little bit more targeted towards schools. And many of you know Ashley Lowe, who works with me. So she has been talking to some of your nurses while we're doing the stock inhaler training. And so those will be coming out as well. And you might prefer those flyers. I did see a question pop up about compensation. And yes, there is compensation. $15 each week for completing the weekly study activities, the swabs and the questionnaires. And then if the parent wants to have their child's blood drawn, it's $50 for each blood drawn. So again, we just wanted to let you know that this is available because I think we started enrolling last week, and we have over 500 people that have contacted us because I think the surveillance testing is very interesting for a lot of parents of children. So we just wanted you to be aware in case you heard anything about it, and we'd be happy for you or any of your families to enroll your children if you'd like. And I am in charge of pediatric recruitment, so any questions that you have, I'm happy to answer.
Awesome. Thank you, Dr. Gerald. Would you mind dropping your email in the chat so that if folks need to reach out to you, they can do so?
I will.
Yeah, so good opportunity there to contribute to the ongoing research and the ongoing support for why vaccinations for all ages are important as we try to continue to mitigate the spread of COVID. A couple of things we need to cover. First thing is the layered mitigation strategies and the importance of testing, right? So this is going to be a hard-fought battle for some of you all. But we are hoping that we can encourage you all to just communicate to your parents and families as much as possible to encourage to participate in any kind of pooled testing or any kind of testing option, give consent to that for their children within your school district over the next coming year. It's going to be really critical in order to avoid large-scale outbreaks within your classrooms. That this is a prevention option, a mitigation option that you have the ability to participate to or participate in, and in the long term, it'll help just prevent any kind of classroom shutdowns. The biggest mitigation strategy that we're asking again for help in communicating, and I know you all are doing this, so I appreciate your strength and willingness to continue on this road, but just the encouragement of masking, the consistent and clear encouragement of masking to the greatest extent that you can. We're all going to try to work on communicating that message better. We're looking at redoing and revamping some of our communications to address what that looks like and how we go about doing that, especially for unvaccinated populations. The masking is a key thing that's going to help us prevent, again, ongoing outbreaks and just rapid spread of the COVID virus and the Delta variant. There's a few things that we need to touch base with today. The first thing is the website. So as I go to the school website, you all are familiar with this. I'm going to drop this link in the chat one more time, but definitely please, if you haven't already been to this site, go to it and save it as a favorites tab so that you have very quick and easy access. Off of the Pima County Schools page, one of the first things you'll need to see is this sanitary measure. There was an error on an earlier publication of this. That error was fixed 4 days ago. So if you have cookies on your tab and you're using an old link, it'll take you to the old order. What you'll want to do is you'll want to go to this order via the website here. This is when you access it from this site. This is where you're going to get the latest information from, is from this site. The link and the bullet point that was under question was bullet point number 5 here. I'm going to zoom in on that a little bit more and just clarify something that was said previously. On the previous iteration, this says collected on or after day 10 of quarantine. That was a misstatement. We clearly needed to make that after day 5. So this is in reference to the shortened quarantine, which is after day 5. The student can take a test and then return after day 7 upon providing documentation of that valid test result in combination with the fact that they have been asymptomatic or they have not had any symptoms. Okay. So important point there. We are doing daily updates on this webpage right now. So what I would encourage you to do is keep up to date with this as much as you can. Scroll back often and just check and see when new documentation has been updated. We'll use this meeting as the big hauling point for when we keep those updates verbally confirmed with all of you on this call, as well as the Tuesday call. If you want to take part in the Tuesday call, you're more than welcome to do that as well. We do a Tuesday at 9 a.m. and a Thursday at 11, but there is a specific focus between the two of those, between private and charters on Tuesday and public school on Thursday. All right, so let's scroll down a little bit more. We have some COVID-19 cases dashboards up and available from our local school districts. We want to thank them for putting that information up and making that publicly available. I do want to pull you over to the data and reports one more time and just show you where we're at currently. When we go to the vaccination, there we go. Okay, good. I've gotten a lot of questions from schools lately about vaccination rates based on age. So I want to show you a piece of this tool. Let me go back and collapse this one more time so you can see how I did that. I've got doses by age. Top right-hand corner, there's an expand box. I'm going to click that box and it's going to pull out this chart. At the top right and the top left, there are these two sliding function buttons. When I click on this and drag this over, it's going to adjust the age range represented on the bar graph. I'm going to pull this down to 20. I'm going to grab the one on the left-hand side and I'm going to slide this over so that it's representative of the age of 12. As you can see, we've only got 6,914 individuals vaccinated at the age of 12 in Pima County at this point in time. We are working hard to try to increase this as much as possible. We are scheduling schools out as quickly as we possibly can. We've worked with Vail Unified School District and have events scheduled at other sites. We're in collaboration with TUSD right now to get more of those scheduled out. We have a load of privates and charter schools that have reached out to us to schedule vaccine sites at those locations as well. We're currently working up to capacity of where we can do 3 separate schools a day. We're not at that point right at this exact time, but we are working to get that capacity. So just know we're going to try to hit as many schools as we possibly can over the next week, 2 weeks, 3 weeks, until we can get to the age reduced range where we can start administering Pfizer under the age of 12. There was a note on that. In the previous iterations of this, it was believed that that age reduction under 12 for Pfizer administration would drop in late September. It looks like there are some more studies that are needing to be conducted with the Pfizer trials. So that looks like it's being pushed back another month. So we may see Pfizer availability for under 12 now in the month of October. I will keep you updated on that as I learn more information about where that's currently at. So as soon as we have a solid date, you can bet your bottom dollar that we will be emailing that out and making that as loud as possible to all of you all through email and through this webinar session. In regards to booster shots, there's been no discussion on those or no update in that as of yet. Again, I will keep you posted as soon as we hear that information. Cases, we're at 120,000 total. I'm going to please remember that this dashboard gets updated based on ADHS, which comes back to us at least sometimes up to a week late. So the most accuracy when you look at cumulative cases by date will be 7 days in the past. There's a couple of slides I'm going to pull up from case count updates that this is a brand new iteration of this. You will see this in future sessions here, but let me pull up just this slide for now. So this is as of July 20th. If we go back to July 11th, you'll see this number of outbreaks jump up by a few, but we're going to go from July 20th for our case counts. So as of the 20th to the 4th, we've had 9 K through 12 schools outbreaks. You've heard me say in the past 12, that was from July 1st. So you may see an update on this number. We have a few more under investigation again today. These are in general where our outbreaks are coming from and the number of cases associated with those outbreaks. Jumping down to COVID cases by MMWR week, you can see we're starting to get a jump up here. We've had 829 for that period down there. 721, these are by day from March 3rd to August 1st. So again, you can see we're starting to get on the front end of a hump. This drop in the line right here represents the fact, again, that we don't get confirmation of those cases back from ADHS in a real-time format. It's backdated information. So which explains, again, this drop right here that you see in this bar graph is because this, in a couple more days, you'll see this continue to climb. Information on deaths by MMWR week, hospitalizations, all of that information. I'm gonna skip a lot of this and we'll give a deeper dive analysis on some of this in future sessions. Here for schools, you can see the total number of cases by staff and students. This is as of last year. So we'll get some updated information that'll come out from the 20th on this as well. Cases by school district. This is for the current period. Total cases by school, cases by school with more than one case, cases by school by students, teachers, and grade level. So again, all this information we're going to be sharing out on this session in the future just to try to keep things up to date as best we can. The last thing to touch base with you all today is a lot of you should have received an email from me yesterday that looked like this. If I can grab it and pull it up here. Good afternoon. Thank you for your continued case reporting. Your efforts are supported contact tracing and case containment. Your ongoing conversations and reflections are helping us to perform continuous process changes and improvement. We're adding a second reporting option to multiple case reporting. Okay, so some of you maybe got this information and you're like, wait, what's going on? If you're familiar with the Qualtrics system and you know how to do that and you have the link and you're already reporting using Qualtrics, please continue to do that if that's comfortable for you. However, what we found is in the last couple of weeks, the volume of cases, the volume of outbreaks, and the volume of close contacts has been really high. So what we've done is we've introduced this this form, which this form is going to be revision 1. Okay, it's a form that was attached to that email from which you can list all of the positive cases or close contacts in this box here by selecting from the dropdown, either positive case or close contact. It's really important that if it's a close contact over here in exposed by, it needs to list who the person was that exposed this close contact? Who was the positive case? So I'm going to do a quick demo of that here. And we'll be doing a training session on this too. So this is a brief overview. You'll get a recording of this training session that will replace the link embedded on the website currently. So for positive case, we're just going to put GA for expediency's sake here. A, that's the positive case. This is the close contact. H, S, just making up random letters here, exposed by G, A, okay? Then when you go through the rest of this form, please make sure to pay attention to the columns here, the exposed by, date of birth, grade. Homeroom is really important. We have to make sure we have the homeroom's teacher so that we can go back and make sure we investigate any outbreaks that are pending. We will continue to rely on the actual in-person calls with you if and when those outbreaks do occur, but it's really going to be helpful for us in tracking this homeroom information. If there was an extracurricular activity involved, you can list that here. The exposure date, date of illness onset, last attendance, date of positive, date the health department was notified. That's just the date you submit this form. The rest of this is all compatible with the Qualtrics information survey that we've used in the past. Now, again, I want to repeat the intent of this. I know that a lot of your schools are already collecting line lists on either cases or close contacts. We are really striving to make this an easier process for you. So here's the next thing that we're going to need from you all. We're going to need feedback by next Wednesday at noon, okay? And I'll put that in the chat on if you're using this form, how functional is it? What are the things that you want us to change around it? And how do we go about doing that? One important thing to note on this is that there are two tabs on the bottom, student and staff. So if you have staff, it's going to be a separate call out box than student, okay? So that's how we're designating this for now. If you're going through this form and you're using it and you're like, this is horrible, we can't put in the information we need it the way that we need it, and this isn't working, then I need you to please reach out to me directly and let me know what we need to do to change this. I want to repeat again, the intent of this is to make your case reporting and your close contact cases, those reports just way easier than the Qualtrics survey. And I think that'll help if you have more than one positive case to report or if you have excess of 20 close contacts, okay? After we get that feedback next Wednesday at noon, we're going to send out a revision number 2, which will get sent out on 8/13. Okay, so you'll see that come out next Friday the 13th. That's when the next iteration of this will come out. Question from Sherry here. Do you mean the date of the test and case results come in the next day? So that is the date of the positive, Sherry, is when they took the test and it came back positive. The date of that positive is when it was conducted. So great question. I can see already where that's going to be language that we'll need to maybe clarify on this. Okay. So if AG took the test on 8/3, that's the date that'll get entered into there, okay? And then from here, let's say that notification happened today, that date would go in this column here, okay? Kate, absolutely, if you are able to and you want to use this, go ahead. If you're familiar with Qualtrics and you just want to use the Qualtrics link that you already have, you can do that as well, okay? On date PCHD notified, is that the date that we notify you of the case or the date that the parent states that they called you? That is the date that the school is sending this form to us, or the date that you let us know. There's some things around that we're looking at potentially changing, but just for now, that's what that column is for. Okay. All right. So how do we submit this securely? That is the really important question, because you cannot, please, and I can't repeat this enough, you cannot email this directly to me or anyone at the county. It contains medically sensitive information and would violate HIPAA and all kinds of other things. So in the email that I sent you, you will see here, file upload link. When you click that link, it's going to take you to this page right here. Your name goes here, your phone number goes here, your email goes in here, your district goes in here, If you have a school, you'll put in the school here, and then you'll just drag and drop your file directly into this bar, then click submit, and we get it. It's done. It's through Qualtrics, it's secure, it's gonna protect you legally, it's gonna protect us legally. That way we don't have to worry about any of that other information, okay? For those of you who do not have that email, I will send it out again today, and I'm gonna drop the link to this into the chat right now, okay? Before I go any further, Catherine Wells, who is our data team lead, who's been doing a lot of like the management around this particular process, and has done it in like literally a day and a half of crunch time. We've been able to pull this together. Catherine, if you're on, if you want to just clarify anything that I missed or anything else that you want to state, I'll talk about contacting us regarding troubleshooting here in a second. And Catherine may not be in. I'm going to try to dial her in right now. Okay. So when Catherine jumps on here in a second, then I can ask her to clarify any other points needed. Okay. So that's again where you're going to drop the form. If you need the copy of the Excel sheet, please email me, brian.eller@pima.gov. I'll get that to you immediately. The second version of this will be given out to all of you in the same distribution way on the 13th, Friday the 13th of next week. I want to just reiterate one more time, when you do this, please make sure you designate positive case close contact in this column, the homeroom teacher in this column, and if they're the close contact, who were they exposed by? And if they were exposed by someone that a positive case that was reported previously, you can put that name in here as well, okay? Okay. If you need support when you're filling this out, because we're going to imagine that that's going to happen a couple times, you've got our phone number and you've got our email address. I'm going to go back to our main schools page. Phone number right here, 724-7018. That will take you to either myself, Emily, Sylvia, or Alva. One of us will help you with getting the form filled out appropriately and submitted correctly. We're in the process of filming a training video right now to make sure that all of that is easily accessible. You'll see that replacing this link right here, how to report a case. This is on the previous process. This link is gonna take you directly to Qualtrics in the next drop as well. So you'll see that change in the next day or so. Okay, I am shocked because I got through all of that in under 30 minutes, and that was a lot of information. So really quick, what I'd like to do is I'd like to open it up for any questions, comments, or concerns. Question from Sherry Dahl, any guidance on indoor gatherings? So the health department strongly suggests that layered mitigation is put in place for schools and for indoor gatherings. We strongly suggest that all individuals mask regardless of vaccination status. We strongly suggest that those who are not vaccinated mask with fidelity. We strongly suggest that 3 feet of space in between students be adhered to in terms of physical distancing to the best of your abilities. Most importantly, we want our kids in school. That is our main objective and has been our mantra for the schools team and for leadership, is we want our kids in school. And we want to do that safely to the greatest extent that we possibly can. So that is the extent of the guidance I can give you on indoor gatherings. What I can tell you as well is that we're currently developing a new template that will provide you with a whole bunch of resources off of a one-pager that's based off of King County in, let me pull this up. So this toolkit, the guidance for K through 12 schools, is a really great 26-page document. I'm going to drop this link in the chat. We're currently putting out our own iteration of this. So you'll see some guidance that's similar to this that we've narrowed down to one page with resources linked into that one page. This is a really robust and great tool to use, and can help you have internal discussions about what kind of guidance you'll put into place at your individual sites. It's really important to know that the health department cannot mandate anything except for case reporting. We can mandate the quarantine and isolation of individuals who are positive or who are exposed based on the sanitary measure. All of this has the legal guidance that you'll need, including the state statutes for that. This does apply to private, charter, and public. Okay. Recommended group number maximum for indoor meetings. Sherry, I will try to get you a number back on that to whatever length I can. I don't have that right now. It will probably depend on the size of the room. And what the only guidance I could suggest as a blanket statement is, as long as you're ensuring physical distancing, that's probably the extent of what you're going to be able to do for a room size. So I hope that helps. Any other questions, you can feel free to drop them in the chat or on mute. I am going to conclude us exactly at 11:30 today. So if you don't have time to get your question addressed today, you can reach out to me via email or via our phone number through the phone assistance line. I'll drop that number in the chat just in case anyone doesn't have visual access. And verbally, the number is 724-7018. That will take you directly to one of our schools assistance liaisons. Okay, so I want to do a quick, concise wrap up of everything that we did. Feel free to continue posting either questions, comments, or asking questions as I go through this. We covered Dr. Gerald's program through the University of Arizona and the vaccine work that they're doing around children. We covered the pooled testing, and again, are encouraging you to sign up for pooled testing, get testing into your school system, regardless of how many parents consent to testing. It's going to be a helpful tool, and you may find that eventually more parents sign up to consent for testing in order to keep their kids in classrooms. Layered mitigation, implement that as much as you possibly can. Christy, I will send out the email that Dr. Gerald sent me directly to this distribution group, so all of you should get that. The newsletter. So as you know, right now we're a little short-staffed on the school side of things. We are currently trying to hire to boost up our capacity. The newsletter is going to take a little bit of a pause. We will be putting out as much as we can, but these recordings are going to serve as a interim accessible guidance piece that you can reference throughout the week. We covered the website, the sanitary measures, some of the updates on the website. Just a reminder, please make sure you check that daily if it's within your ability to do so, because all of the updates as they happen will be happening on a daily basis now on this website. The sanitary measure was emphasized. And the last thing we covered today was the new case reporting option. You can continue to use Qualtrics. We encourage you to do so. However, if you've got just if you just need to drag and drop, cut and paste stuff into a spreadsheet, you can now do that with this new tool. Okay. Woo, we did it. Hey, one last thing. I want to share something with you in the interest of encouraging you to do something for yourselves as well. This last weekend, you all heard me, well, last Thursday, you all heard me talk about some firm boundaries that I've had to lay down around work. So because of that, I ended up going up with my kids to Mount Lemon. We took a great hike on one of the back trails. We got a bunch of oyster and shaggy Maine mushrooms. We made a mushroom omelet the next morning with those. And I just really got to spend some quality outdoor nature time with my kids and with my family. And I'm sharing that with you because it's been a really stressful couple of weeks for all of us, I'm sure. It's really important that you all take time to practice self-care in whatever way you can and schedule that out. So keep doing those things, all right? That's going to conclude the session for today. Thank you all for touching base with us all. Christy, I'll get that letter sent out from Dr. Gerald here shortly. I'm going to stop recording at this point in time.